topic, physician wellness, it will cover a lot of things which will be helpful for our own self and for the patient. So first we'll discuss what's wellness and what are the physician personal health behavior and what is physician burnout. First we need to check what is the current status and what kind of health behavior we are having. Then what are the leading risk factors of chronic diseases, and in all of this what is the role of epigenetics. Then how to intervene and how to improve ourselves. First of all, I'll give you some evidence that how plant-based diets and lifestyle interventions has a lot of effects on chronic diseases. And then what are the 6 pillars of lifestyle medicine, and few words on food adulteration. Nowadays a lot of toxic exposures are happening even through healthy food. And then the role of gut health and why physical activity is now as a vital sign. And then what is PERMA? It is related to positive psychology. Sleep is very important, so effects of sleep on us. And then eudaimonia and blue zone project, which is something new for, at least it was new for me when I was reading on lifestyle medicine. And we all know, but exactly what it is I'm going to tell. And finally the conclusion. So what is wellness? We all, so most of us are trained to see the word wellness to mean absence of disease. We think, okay, we are not having any disease, that means we are well. So basically disease means sickness and no disease means wellness. It is not like that. So what we are thinking, it's an outward focused evaluation where we are just thinking of the physical well-being, and that too in the disease perspective. But if we see overall, we need to know how mentally we are healthy, how emotionally we are healthy, and then lately it comes the physical part. And disease comes when there is an end organ damage. So physician wellness is way more than just absence of disease. And so we need to maximize the quality of our life. That's very important. It is about how much you enjoy yourself, how much you feel your work makes difference in people's life, then quality of your relationships. Everything is very important. And you can be disease free but have a very crappy life. You're always tensed, you're not sleeping well or not eating well or don't have time for yourself, or you may be having multiple diseases but you are dealing with them in a positive way and having very satisfying life. So it doesn't mean that if we are not having disease we are well. We have to be well in all the context. So wellness is about thriving rather than simply surviving. So until now in medical schools, what we have done, there was a lot of traumatic processes, a lot of studies we have done. And we have initially what we did is like surviving ourselves in process of becoming a doctor. And we wanted to get higher marks and a lot of duties, maybe 24 to 48 hours duties. And we just to survive ourselves to become a doctor, it took almost, everybody takes around 10 years to do that. So during this process, what happens is the health part, the self-care, that is mostly ignored in most of the specialties in our profession. So now is the time where we take care of ourselves and our patients in a better way. So if we see personal health behaviors of the physician, this was a Canadian survey, California physicians, they found that 53% of physicians had moderate to severe stress, no exercise or occasional exercise in 35%, and less than 6 hours of sleep in 34%, no breakfast in 27%, using sedatives in 13%. And in 2012 survey, they found that 53% of primary care physicians were obese. So you can see, and even the residents, they are overweight and they under acknowledge their overweight status. They are not eating healthy. So this is the current scenario. You can see almost 30 to 50% of physicians who are going to take care of the entire population, they are having all the bad lifestyle issues. So we have to focus on them, and we are prone for burnout. So many studies have shown that physicians continue to practice this poor self-care throughout their career. First, we have to get good marks, then we have to pass our exams, then we have to find our jobs, then we have to excel in our practices, in clinical practices, and somehow we ignore our own health. So burnout is defined as a syndrome of high emotional exhaustion, high depersonalization, and sometimes low sense of personal accomplishment, because always there is some kind of comparison all over in the world going on in our profession. And there was a survey in 2019, and they found around 35 to 45% of nurses and physicians were suffering from burnout. And in medical school students, it was way higher. It was 45 to 60%. And this overall poor self-care also lead to unintended consequences, the suboptimal care of patients, because if we are not sleeping well, the chances of error and lack of concentration will be more. So why we are talking of all this? Because somewhere with all the ignorance, we attract kind of diseases, chronic diseases. So this is the data from US, where you can see obesity. Can you see it is 68% now prevalence? More than one of the three heart disease risk factors, almost half of the population is having, like uncontrolled BP or LDL cholesterol or smoking. Then hypertension in 33%. So all these things are preventable by lifestyle changes, and then rest all this, the list. Then what are the risk factors for these diseases according to this global survey? If you see, the main thing is high blood pressure, and nowadays almost everyone after 45 or 50, we are we are having high blood pressure, at least 130 to by 90 or 80. So somewhere this is very important. And then a lot of smoking, household air pollution, and then high body mass index. Almost 50% of population is now having overweight or obesity criteria on their BMI standards, where the BMI is more than 25. Then high fasting plasma glucose. And what we found, that all these things happens mainly because of poor diet and physical inactivity. So they said that dietary risk factors and physical inactivity collectively accounted for 10% of global dailies. Dailies means disability adjusted life years. So you can see, if you are not eating well and if you are not physically active, we are going to increase the burden overall. And if we see overall the cardiovascular fitness levels, that how much we can run and walk and other things, which I'm going to tell you in detail. So this was the stronger predictor of mortality rather than these traditional factors like smoking, hypertension, cholesterol, and diabetes. So friends, if you are thinking that if you are not having all diseases, we are healthy, it's not like that. You have to be physically active. Your cardiovascular fitness level has to be good, and your diet has to be good. Because these are the strongest predictors of the future chronic diseases. This is the Indian data. Here you can see this was little old, around 2001, but still I think it will be same. Prevalence of obesity in physicians, 48% and 51%. You can see almost 50% of our physicians are having this issue. Truncal obesity is very high, 65%. Hypertension is around 33 to 20% in female. Diabetes in around 9 to 12%. You can see cholesterol 44%, LDL cholesterol 70%, it is high, and triglyceride levels in 18 to 12%, it's high. So this is all the Indian data among physicians, and around 2.3% are having smoking or tobacco habits. So you can see we are the representatives of the health, and we have to take care of the entire population. So you can see what kind of healthy behavior we are having, and having a lot of chronic risk factors. So physician wellness is very important. How to improve? First of all, why it is important? Because it will overall increase our own personal well-being, and high quality of healthcare will be able to give to our patients also. So now a culture change is needed. We need to plan some strategic plan even for the mental health of the physicians, and especially residents and students. Why? Because those are the learning years. Whatever they are going to learn in those first 10 years, they are going to apply in their future. So it's very important to include residents and medical students on time. Otherwise, whatever they are doing on themselves, they are going to tell the same thing for the patients also. Or otherwise, even if they are saying good things and healthy lifestyle, nobody is going to listen because they are not following it. So we have to target at the individual level, structural level, and system level, and we have to shape the attitudes of students towards the self-care and wellness. And in, at least in students, they are very suppressive. Try to see the early warning signs of distress, and they should seek help for this. So burden on physician is too much. Definitely in India, it's high population. We see 2,300 patients and we give 15 minutes average. But if you actually want to give a good quality to the patient, where you want to prevent a chronic disease, on one patient you will require 7 hours if you want to do according to guidelines. So only physician cannot do all the jobs. So we need to train fitness professionals, our dietitians, psychologists, and other people, so that they all are there in one patient care, where when you are dealing with the chronic diseases of the patient. So overall, we need a stronger organizational structure to reduce the physician's burden. Now what happens is, we are not advising on diet or physical fitness. Patient will come, you didn't tell us, but we don't have time. We are bound to see a lot of patients. So there is a definite need of improving on those aspects, where we are training more medical health professionals also, so that they can give the guidance on lifestyle factors to the patients. So if we see 80% of premature deaths are happening because of tobacco use, poor diet, and lack of physical activity. So you can see it's not your genetics, it's mainly your diet and physical activity, and which is in our own hands. No medicine can replace this. So only when they did a survey, only 3% population had a sufficient healthy behavior. Okay, and if you see, only 23% had adequate amount of fruits and vegetables, that is 5 servings of fruits and vegetables, and only 22% were physically active. So you can see a very less amount of healthy lifestyle behaviors. And so poor diet quality is related to more deaths than tobacco, high BP, and any other risk factors. So it's not that you are having hypertension or you are, it's mainly what we are taking in. That is very important. So dietary habits account for 1 in 5 deaths globally. So if we are ourselves improving and we are improving our patients, we are going to change the whole world, not by giving medications, but they are improving their micronutrient status, their antioxidants through different kinds of diet. So if we see the disease and longevity and associated with diet quality, you can see if you're not having fruits and vegetables and having high red and processed meat consumptions, your overall morbidity and mortality will be high. And you can see here 11 million deaths in 2017 and 255 million disability adjusted life years were due to dietary risk factors. So, and you can see here the high intake of sodium in 3 million deaths because of that. Low intake of whole grains. Nowadays, what we are doing, only one kind of grain we are eating. We are forgetting all different 20 to 50 varieties of grains. And we are not having fruits at all. We are just going to have some dal chawal and some sabzi roti. We are completely forgetting nuts, fruits, seeds, and salads. So these are the major causes of longevity, good lifespan, and health span. So ask yourself where we are now after giving this much of data. Are you following a healthy behavior or not? So why plant-based diet, and what kind of diet quality we should pursue for ourselves and for our patients? So there is a lot of evidence now on the change on epigenetics by just an intensive nutrition and lifestyle change. This was published by Ornish et al. In prostate cancer. They just did intensive lifestyle interventions on food, physical activity, sleep, residential programs to detox their mind and their gut and their diet. And they found that there was changes on their genes. So cancerogenic genes were down-regulated and anti-cancerous genes, 48 genes, were up-regulated. So each of these genes played critical role in tumorigenesis of prostate cancer. So you can see that even you can reduce the incidences of cancer. So factors that reduces cancer is basically you have to be more on the plant proteins. If you are having non-veg proteins, the chances of cancer will be more. So Here in intervention group in early stage prostate cancer, what they tried, they gave them low fat plant-based diet, they did stress management interventions, and what they found, the prostate cancer cell growth reduced by 70% without any chemotherapy, without any radiotherapy. And in control group it was reduced by 7. So you can see the difference. Even in breast cancer they have done the same kind of interventions, and in what for 2 weeks they have given this, and you can see the IGF which promotes the cancer growth, which was decreased after lifestyle intervention and nutrition, and greater survival after breast cancer in physically active women. So diet and physical activity important in cancer for sure. And then now the heart disease and cholesterol. So normally what we say that more than 200 cholesterol is bad, but the new definition according to lifestyle medicine, the cholesterol should be less than 140. So if anyone of you having more than 140, it's high only, because this is going to increase your atherosclerosis and plaque progression. And the optimal LDL should be 50 to 70, not less than 100. So if you're targeting your LDL less than 70, the chances of having atherosclerosis plaque progression will be almost nil. So plaque progression ceases when total cholesterol is less than 150. So when they compared the omnivores versus vegan, if you're a non-vegetarian person, you can see the overall average cholesterol will be high. It was 123. And in vegan, the overall cholesterol you can see 69. So just by changing your food choices, you are just going to reduce your cholesterol without taking any kind of statins. So that's very important, because all hypertension, diabetes, heart disease, stroke, everything is because of high cholesterol. So the best way to manage coronary artery disease is to use very high fiber vegetables, fruits, and nut diet. So now this trial was a randomized trial. It's a lifestyle heart trial by Dean Ornish again. He has done a lot of work in prevention and treating these chronic diseases. So here they didn't even give any lower lipid lowering agents, and they followed 10% fat from whole food vegetarian diet, aerobic exercises, again stress management, and group psychosocial support. And they did 5-year follow-up study. You can see at 1 year, the coronary artery stenosis decreased by 1.75%, and at 5 years, 3.1%. And in control group, who were already on American Heart Association step 2 diet, the overall diameter increase was there. It was not decreased. So here you can see, if you're becoming completely vegetarian and having aerobic exercise and stress, you can reduce your stenosis also. And this was documented on repeat angiography. So this is a very major trial for the coronary artery disease. And this is the study from Dr. Caldwell. Here it is the 12-year experience. They have arrested and reversal of the coronary artery disease they have done. And they have found even stress management is very important apart from dietary changes. It has reduced 91% reduction in the frequency of angina. So whole plant food diet, no oil, no meat products, less dairy, increased fruits, vegetables, and legumes. So what they saw after 12 years, that adherent patient had no extension of disease and no new coronary events. And another case series, they found that if patients are on this kind of management, recurrence rate is just 0.6% versus non-adherent patient, it is 62%. So almost 100 times higher if you're not following. So it's not that we are just starting the patient on medications and then we are saying you are getting treated. No, you have to change your lifestyle and diet. Another thing, in post-menopausal status, a lot of women physicians, we have to take a lot of soya proteins because they changes the gut microbiota. And these changes through soya proteins, they reduces the obesity, they reduces the metabolic dysfunction and metabolic syndrome in post-menopausal women. And the overall, if we are not having soy proteins, then chances of increasing obesity in post-menopausal women will be more. So this is also very important. And then what is the effect on glucose metabolism? So here in randomized trials, they have done on plant-based dietary interventions on glucose metabolism versus an omnivorous diet. And you can see there's 65 publications, 9 trial with overweight, obesity, type 2 diabetes, and cardiovascular disease, that overall plant-based interventions improves the markers of glycemic control. So even for diabetes reversal, we need to increase the fiber and vegetarian diet and this is very important trial, direct trial on type 2 diabetes. You can see this is also a randomized trial. They withdraw all the anti-diabetic and antihypertensive medications, and they gave patients 800 to 850 calorie per day for 3 to 5 months. And they achieved 15 kg of weight loss. By doing that, 86% achieved diabetic remission. So without any anti-diabetic medication, their HbA1c was less than 6.5%. So now we have enough evidence that's how lifestyle can reverse and treat the chronic disease from root cause. And now the very important cause here is 70%. Why gut is very important? Because 70% of immunity is in our gut. So all immune dysregulation is going to happen if we are having bad gut microbiota. And a lot of autoimmune diseases, allergic diseases, and cancers, fatty liver, everything may happen if we are not taking care of our gut microbiome. So we should always ask, are we having a healthy GI system? So what are the criteria of healthy GI? It's not that we are not having acidity and diarrhea. You should have a normal nutritional status, like your mineral, all the contents, and you should be GI symptom free. No constipation, your stool consistency should be very good. There should not be any enzyme deficiencies or intolerances, and no acid issues, no bacterial overgrowth. We will not know bacterial overgrowth is there or not. So normal composition of and vitality of gut microbiome is very important, which is going to happen through diet and physical exercise and sleep. Then effective immune, if somebody is getting ill, if somebody is having repeated throat infections, the problem is in their gut microbiome. It's not that you are having very healthy GI system. So you have to work again on your diet. And then status of well-being. If you are always feeling depressed, that means our bacteria are bad inside our gut. So positive gut feeling, positive well-being is another sign of healthy GI system. So now the epigenetics, we actually 70 to 90% of diseases happens because of epigenetic change. So overall, what we are taking from our family is only 10%. The gene explain only 10% of the variance of the disease. And what is epigenetics? So we have a DNA, and the near DNA we have a lot of changes on histone acylation or on DNA methylation, and these all factors which are going to affect the final gene expression, they are controlled by environment, drugs, aging, diet, and the development in utero and childhood. So these are the factors which are going to change your epigenetics. So what we have to do, how to change the epigenetics, because if you are changing, so that's how the cancer gets reduced, because we change the epigenetics by changing the diet. So key influencers of epigenetic, it's diet, exercise, sleep, and obesity. So if you're having healthy diet, good exercise, and sleeping well, you are changing your genes, you are changing your genetic expression, even for yourself and your future generations. So your genes are not your destiny, your lifestyle is your destiny. The change you make today will change your future. So this is all about what is the problem and how nutrition can change the disease process. Now in lifestyle medicine, why it is different? Why it is different? Because here the 6 pillars are not medication. It's nutrition, physical activity, sleep, stress management, avoidance of risky substances, and positive social connections. So these are the pillars. We have to work on them if actually we want to be disease free. And the role of diet is foremost. The food you eat can be either a safest and most powerful form of medicine or a slowest form of poison. So friends, we have to check whether we are eating a powerful medicine or a slow poison, what kind of food we are having in our plates. So we have seen that how plant-based diet changes the whole disease process in various diseases, but how it does. So plant-based diet, if we are taking, the healthy bacteria will grow. Okay, and the bad bacteria will be less. So bacterial diversity will be maintained if you are having plant-based diet. But if you are having Western diet like chicken, pizza, pasta, non-veg and all, we are going to increase more opportunistic bacterial metabolites and a lot of lipopolysaccharides, a lot of inflammatory cytokines, and the overall beneficial bacteria will be less. And if you are having plant-based diet, opposite will happen. So definitely you're going to prevent a lot of diseases. So when the plant-based diet is there, like Mediterranean diet, you are going to increase your short chain fatty acids, GABA, vitamins, indols, polyphenols, so healthy promoters. But dysbiotic microbiota by all non-veg food. So a lot of inflammatory processes will aggravate in the body. And here you can see how gut microbiota makes you prone for chronic diseases. So you see the gut microbiota here, it's the entire immune system of GI tract is controlled by gut microbiota, entire immune processes, autoimmunity, allergies. So if we have a bad bacteria, there will be inflammatory bacteria, then it will activate your gut associated lymphatic tissues. There will be visceral fat deposition. There will be impaired leptin and ghrelin signaling. Because of that, there will be diabetes, then a lot of systemic inflammation because of release of lipopolysaccharides, and because the gut associated lymphatic tissue is getting activated, so a lot of inflammation and autoimmunity. So all these will cause obesity, diabetes, cardiovascular disease, and on top of it, when we are taking bad food, not sleeping, having smoking, alcohol, then everything will definitely increase. So if you're having plant-based diet, it has a lot of fibers, antioxidants, unsaturated fatty acids, which is good, phytochemicals because they are going to reduce your cholesterols, and healthy saturated fatty acids. So if you just exclude animal origin diet, you are going to reduce obesity, type 2 diabetes, hypertension, and some of the cancers. It is proven now. And the prevalence of obesity will be less always in vegetarians and vegans than the omnivores. So definitely, and plant-based diet is very important for weight loss and weight maintenance for both of us. And you can see here, what are the pictures? You can see all insulin sensitivity, glucose uptake, vasodilation, blood viscosity, everywhere the vegetarian will have more advantage. So the plant-based diet has been suggested as an effective lifestyle change that may reduce the degree of obesity, and it improves the glucose metabolism. And before we talk of all these, we should be aware of little bit about the adulterations also. So nowadays in food industry, they want to increase the production. So there are intentional adulterants like putting marble chips, stones, chalk powders to increase the production. And there are certain accidental issues like during transportation or storage or storage and handling, and pesticide residues. That's why we are having a lot of autoimmune diseases, allergic issues. I'm seeing in children a lot of recurrent pain, abdomen, and I have to just stop all packet food and they are fine. So some kinds of chemicals, they are getting irritated. And in endoscopy, a lot of new changes are there. So in fruits and vegetables, if we see, they put some spray and to prevent the dehydration of the apple. So what happens is, if we are not peeling it well and we are eating, we are having a lot of wax and stuff they spray on apples to make it more shiny, and so that they should not get dehydrated, to prevent ripening, all that they do. And in oil and ghee, they use cheaper oils like castor oils, mineral oils. They add all those things. So again, it becomes adulterant. Even ghee is nowadays, it is a cheaply available animal body fat. That's why we say, no, we are not eating anything bad, but we are having biscuit. Now biscuit has made up of dalda, which is a bad fat. And they will say that why we are having everything healthy. No, even if you are having biscuit, it's a trans fat. According to 2018 FDA guideline, biscuit and bakery products are no food list. So we have to be aware of all those things. Milk, a lot of preservatives are there in the milk products. So the previous milk was good. Nowadays, as a gastroenterologist, most of the diseases I have to stop milk because this is all adulterant milk with a lot of hormones and pesticides in it. So that was little bit few awareness on adulterants. Now, as a doctors, we are all trained as a medical history, examination, but we don't focus much on the anthropometrics issue. As a pediatrician, I focus But in adults, we don't focus on BMI. We never take BMI. We don't check our own waist circumference, whether we are over BMI. And we have to take the biochemical data also into considerations. Your vitamin B12, D3, ferritin, CRP, HSCRP, HbA1c. Even if you don't have disease, we need to take this every annual checkups. Clinical assessment, definitely the nutritional history is very important. And so waist circumference, BMI, we tend to forget. And behavioral drivers for the food choices. Why we eat non-veg, why we eat drinks, why? So what is the behavior driver? We eat, we know, but why we are eating, what is the root cause behind? We have to check that and try to stop at that point, that why we tend to eat those things. So there are certain over-consumed food and nutrients which we normally do, like added sugars, cholesterols in these pizza, burger, pastas, a lot of artificially sweetened beverages, which is not good. So if you see, according to WHO 2020, the sugar should be less than 6 teaspoons in a day. So that is less than 5% of total calories. And ideal is no added sugar at all. So now you can check yourself how much sugars you are eating and how much it is more. And according to American Heart Association, for women, children and teen, it is 6 teaspoons, and for men, it is 9 teaspoons. So overall 100 calories and 150 calories of the entire food you should have from the sugars. And nowadays, it's not just direct sugar. In salad dressings, in different packet foods, there is a lot of sugar. So you will say it is artificial. We are having sugar free. Even that is an added sugar, what we are saying sugar free, and they changes your gut microbiome. Now on the sodium, this slide very important because 70% of extra sodium comes from outside food. So if you're just stopping outside food, your excess sodium you're not attracting, then you are preventing hypertension for sure, stroke for sure. You can prevent just stopping the outside food. And the recommendations are according to AHA, less than 1500 milligram is ideal sodium intake, it should be there. And so added home food is nothing. You can add something in home preparations. Added at table is also very less. It's mostly the outside food which has a high sodium content. So if we compare, why I'm saying plant-based, because animal protein creates an acidic condition. And you think that animal proteins are very healthy, but actually it causes poor bone health. Because of acidic condition, it takes your calciums from the bones and to neutralize that. So overall, non-veg doesn't have any fiber. It is a non-fiber food, and it creates acidity, inflammation, bad bacteria, and lot of inflammations, colonic polyps, inflammatory bowel disease, cancers are more with non-veg diet. So if you are having variety of whole plant-based diet, you are going to have all good complete amino acid profile which is required. So this is the plate, ideal plate you should have, where your half of the plate is fruits and vegetable. Now you can imagine your own plate, what it is. It may be some big chapati and some vegetable, some dal and some sabzi. But ideally everything will not be there, like fruits and vegetables, nuts, seeds, and different grains, not only one or two grains. So whole food, vegetables, fruits, legumes, grains, nuts, and seeds. Because that's are also important. A lot of antioxidants are required to combat that entire inflammation in our body. And so added sugars and added salts should be less. So this is the ideal American College Lifestyle Medicine plate, ACLM plate. So when we are taking our diet, we have to replace anything unhealthy to healthy, more unrefined from the refined thing. So this is also wheat, this is also potato, but same thing, you can have a boiled potato or sweet potato, and this instead of pasta you can have roti. So if you're changing the refined products to unrefined, you are eating more natural, the chances of having different diseases will be less. So starch is good. A healthy complex carbohydrate starch as an intact is good, but the same thing in potato chips, it becomes bad. Why? I will tell you later. Why? Because advanced glycation products, we never know how much AGs we are taking in by eating fried, by eating burger, pizza, pasta. and more AGs are there in more protein rich foods. So these are oxidative stress inducers. So when you are cooking very high temperature, when you are heating for very long time, when you are eating dry, like nowadays a lot of microwave, air fryer, baking things have come, all are unhealthy. So when pH of food is more acidic, a lot of citric acid, preservatives, all you are so if you are increasing that, canned foods and all, you are increasing the decreasing the pH or altering pH too much, or if the too much of high trace minerals. So this all will increase the advanced glycation products. So cooking methods like grilling, broiling, roasting, searing is not good. You should boil, steam, stewing, slow heat cooking is good. And if the temperature is going more than 240, the AG will be more in the food. Why AG is important? If you are going to increase the advanced glycation products, the chances of diabetes, atherosclerosis, kidney disease, slow wound healing. So check your food, what you're eating. You are going to have a lot of advanced glycation products even in your food. So fiber and gut immune health, I think everybody knows now, it improves your constipation, cholesterol, glucose, and your satiety cravings, and decreases the diabetes. So if you increase your fiber to 65 gram per day, automatically your diabetes control and requirements of dosage of medications will be less. So what is the dietary recommendation? For women, it is more than 25 gram per day, and for men, it is 38 gram per day. So per 1000 calorie, we should have 14 grams of fiber. So when you're explaining to someone or for your own selves, replace whatever is bad, just replace with healthy. So if you're having white rice, have brown rice. If you're having pasta, instead have roti. If you're having bread, instead of that, you can have dalia roti. So that's how you have to practically change the diet. Not like I'm not telling something hi-fi to do. And this is a very important slide. This you can see the oil. So saturated fat is highest in coconut and butter and lard. So these are the main things which we are eating. This butter and lard, peanut oil, these are high in the saturated fats, which are the main culprits of high cholesterol, LDL cholesterol, heart disease. So we should have oils like canola oil, safflower, safflower, flaxseed oil. These are having more unsaturated and monounsaturated fatty acids. So the ratio, you should know which oil is better according to this distribution. So healthy sources of fat. So what we normally do, we try to add butter, cheese. These are the highest saturated fat. So you use more nuts, seeds, avocados, olives. So these are so if you're giving a prescription, you can say that instead of having butter, just spread avocado on the toast. So you're giving healthy fat to the patient and to yourself. And there are certain under-consumed nutrients like calcium, fiber, magnesium, potassium, vitamin A, C, D, E, and iron. Don't think if you are belonging to doctors category and we are in higher socioeconomic group, we are not under-consuming nutrients. No, we are under-consuming because we are not having variety of fruits and vegetables. So these things are less in our body. So this was the all about diet overall. Now I'll be talking few slides on physical activity. So you can see physical inactivity is the 4th leading risk factors of global mortality, and 1 in 10 premature deaths are because of physical activity. And you can see even apart from CHD and diabetes, even breast cancers and colon cancer are because of physical inactivity. So even if you want to prevent cancer, it's not just heart disease and diabetes. Even for cancers, you have to be physical active. And if you're not, if you're physically active, you're increasing your lifespan by 4.5 years than an inactive person. And even just if you're increasing your sitting time, you are increasing your all-cause mortality by 7%. So just sitting, if you're on phone, at least try to stand up or at least try to walk while doing certain things. You will decrease your disease. So always ask how many days a week I am active and how many minutes per day I am doing physical activity. So what guideline says, 150 minutes per week of physical activity or 75 minutes of vigorous intensity activity is good for all health benefits. So at least 150 minutes per week we should take out. So in one day, 15 minutes of moderate to vigorous activity, if you do, you can just complete it. So at least give 15 to 30 minutes. So this is the definition how moderate and vigorous. Moderate means we are achieving our 60 to 76% of maximum heart rate. So while doing activity, we can talk, but we cannot sing. That is moderate activity. But if the heart rate goes up to 70 to 100% of maximum heart rate, then it is a vigorous intensity activity. So where we will not be able to talk. So that's how you can judge I am doing a moderate activity or a vigorous activity. So it has a lot of effects: bone mineral density, body fat, lean body mass, insulin sensitivity, triglyceride levels. All this is going to, but if you are not doing resistance exercises, your lean body mass will not improve. And but if you want to reduce your weight loss, main criteria is weight, then you have to do more of aerobic exercises. And for triglycerides also aerobic. So everything is important, not just walking and running. So, and very important for your emotional health, okay? Because just a single episode of physical activity will improve your brain executive functions, your concentration, your emotional regulation, and sleep quality also. Do at least 15 to 30 minutes in a day. Strength training and NAFLD. If you are doing strength training, you are improving your muscular steatosis, and you're improving insulin sensitivity, and slowly you're decreasing the hepatic steatosis. So somebody is having fatty liver, they should do some resistance exercises. So these are the components of exercise, not just walking and running. Muscle strength, flexibility, endurance, body composition, how much extra fat you have, everything together is a fitness, not just walking and running. So you have to take care of your joints by stretching certain positions for flexibility and balance, and muscular strength by weight lift or a body weight exercises, and cardiorespiratory fitness. So this is, I'm going to skip how to write the prescription. Sleep is very important. Optimum 7 hours of the sleep you should have per night. Minimum 7 hours are required for everyone, okay? And because lot of DNA repair, your leptin, ghrelin secretion, if you're not losing weight, it is because of sleep. You're not adequately sleeping. Your peptide synthesis, fatty acid metabolism, promotion of ATP synthesis, everything happens in sleep. So, and how you are going to have a good sleep is by what time you're waking up. If you are having a carbohydrate meal, how much hydrated you are throughout the day, and how much light exposure you have in the night, like screen lights, and then how much caffeinated or alcoholic beverages you are having in the night time, and then how you are unwinding yourself. So all throughout the day, what you're doing will affect your quality of sleep. So these are the inputs. They are going to affect your nighttime sleep, your core body temperature, your melatonin, your cortisol, your cutaneous blood flow, and finally your outputs like your alertness level in the day, and then next day sleep quality. So this is important. This is lengthy slide, but you can ask me personally on sleep hygiene later on. So a lot of dyslipidemia, elevated BP, increased heart attack, metabolic syndrome, it's just because we are not sleeping well. So try to work on your sleep. Now, stress, everybody knows, a lot of stress are going on everywhere: environmental, social, professional, biological, psychological, everything. So we should have a very good social connection with people. That's very important now. I'm not talking of social media. I'm talking of direct interaction with human beings. And because and we have to work on positive psychology for our own self and for the patient's well-being. And we have to build good instead of just repairing the bad or focusing on the bad. What is lacking in the India, what is lacking in the physicians, what is lacking in the patient care. Instead, just focus on the good. So positive thinking. So PERMA is very important. You should have a positive emotion, a good engagement in whatever you're doing, a positive relationships, a meaning to your life. It's not just surviving or doing a job. You have to have some meaningful life, some sense of accomplishment. So these are very important aspects, because this is going to reduce your work. You're going to enjoy your life in a better way. And how we can do it? Be grateful for what we are doing. Count your blessings. Appreciate more. Have some savoring the pleasing things in the life. And then writing down how you want to be remembered after leaving this world. Do some practicing, acts of kindness. Not always be in job. Do something else and some meaningful activities apart from your profession. Even our profession is very meaningful, but nowadays sometimes it becomes very mechanical. So we have to think from other aspects also. So what is eudaimonia? It's basically you have to actualize your human potential. Even in our profession, everyone wants to do something from their heart, but sometimes logically we are doing because of family, because of job stress, or because we need to earn money. We are trying to decrease our own human potential. So somewhere we have to work. Why? Because if you have a higher level of purpose in your life, the less chances of stroke, heart disease, inflammation in your body. That has also been evidenced now. Even gene regulation happens if you have a higher purpose, if you are working on your own potential. So pro-inflammatory genes will be down regulated if you are happy and you are living for yourself also and taking care of for your own self. So this Blue Zone product, what they found here, they took some 5 geographical locations and they found that these people were living longest if they compared with the rest of the world. And what these people were doing, they were moving naturally, so good physical activity, having some sense of purpose. Mainly they were on plant-based diet, and they stopped eating after becoming 80% full. They were having a lot of relaxation time, and they were putting their family first and find the right tribe. You don't need to be in all conferences or all kind of race which is happening all around. You can find your own tribe and your own passion and work on it. So this is called where the people live longest. So everything put together is going to increase your lifespan and health span. So summary, gut health is very important for all of this, and it is a new approach to preventive medicine. Eat a plant food, and that eat a rainbow means different colors of fruit, different colors of vegetables, and different grades. Be aware of food adulteration and digestive stress by taking care of your mental stress, junk food, psychosocial stress, and sleep. Avoid animal food as much as you can. Support gut health by balanced diet, prebiotics, multivitamins and nutrition, chronic stress. And definitely now please ask yourself, at least nothing else, that how much you are physically active. Because if you're going to start from tomorrow 15 minutes of moderate intensity, you can feel the difference, and then rest of the changes will automatically happen. If you are having alcohol or tobacco, I'm not saying alcohol is bad, but how much and why you are having. So that means you need some pleasure in your life. So try to find different pleasures, not just from substance abuse. And definitely gut health is having a role play in cardiovascular disease, diabetes, obesity, fatty liver disease, everything. So your genes are your destiny, not your destiny. Your lifestyle is your destiny. And maintain some emotional well-being also by applying positive psychology technique. And my take-home message is you are what you eat. So eat more unrefined plant foods and be happy always. Thank you so much.
Thank you very much, Dr. Huda. That was very interesting. You covered like the main pillars, of well-being. You spoke about diet, plant-based diet. You spoke about exercise, and the AHA recommendation and the KDIGO recommendation, kidney disease, and the American Heart Association recommends 150 minutes of cardiovascular exercise. 150 minutes of exercise, moderate exercise, a week. And I really love your statement, genes are not your destiny, your lifestyle is your destiny. It's like a mantra that we can all follow. At this point, if anybody has any questions, Dr. Priyanka will be happy to answer. Please type it in the chat box. But in the meantime, I just wanted to ask you, more not as a physician, but you've done so much work on this. The most difficult things, for doctors and patients, is to stay motivated, especially in India. After I moved here, there's just so many things to eat. It's so hard not to be tempted, and you're good one day, and the rest of the time, suddenly it's January 1st, everybody's on a diet, and then today's the 14th. So can you give us some practical tips on how to stay motivated?
Yeah, so see, this is all I'm talking now, but I myself went to 5 years of very, very grueling meditation sessions, and where I realized that my whole belief system changes. So what happens is, right now, everyone, if I'm going to tell, no, don't eat non-veg, you're going to control yourself. But if we start some inner journey for our own self, then what will happen is slowly, that awareness will increase, that even anything is there in your plate, you're not going to eat. So to keep yourself always motivated, we have to work on our own self. And for doing that, see, this is a first session where I wanted to just, do it some kind of introduction. I have not even touched the topic called motivational interviewing. Okay, so there is a pillar. One of the pillar is motivational interviewing. So motivation is for every person, it's different, and every person, the triggers are very different. So one needs to find out where they become weak. The one slide I showed, and I did a circle also, that what are the drivers for that particular person. So I can give you one homework where everyone has to write when I go weak, when I'm in parties, or when I'm depressed, or when I'm very happy, or when I'm in festive mode. When you know your own weakness and you try to write down it, writing makes it grounded, that you're going to change. Because motivation is not something physical or visible structure. It is more related your subconscious mind. It is more related your overall energy and vibrations. It's all over related to what kind of environment you are in, what kind of people you are surrounded with. So if you want to be motivated, you have to be aware kind of society you are in. So for doing that, I think writing what needs to be done at least once in a week, and before sleeping, not after waking up. Because before sleeping, if you keep reminding yourself, this goes into your subconscious mind, and the whole day you will be very much aware. So I would not say that stop this or stop that. I would say that become aware. The moment you become aware, or take a deep breathing, whenever you're feeling weak, I want to eat this, just have a deep breathing, one deep breathing. You're going to cut that pleasure. That why we are eating bad is from past memory, that we found this kind of pleasure when we ate that. Okay, so we go into that kind of memory and we do this. So having a deep breathing, writing your own journal on the night before you sleep, these two things are going to change the entire lifestyle choices the next day person is going to be. So that's I think that will be the practical aspects. But if you all can suggest me, I do live meditation sessions, and also I can do each and every aspect. Like physical activity can be one of the topic, motivation can be one of the topic, invisible subconscious mind and energy healing and DNA repair, how it happens while mindful based stress reduction technique. So these are the individual topics which we can take in later series, whoever is interested in depth.
Yeah, I think that is very helpful. At Forts, we're very passionate about physician wellness, patient wellness, but, we also have to take care of ourselves first, to be good role models for our patients. So definitely in the future, we want to do more, practical sessions like exercise sessions, where it's not even like a lecture. We could even do like, a live meditation session.
Yes, we can do that. Online also we can do that. Yeah. Even we can do certain wellness retreats. There are a lot of options, because talking is not going to apply. The wellness is something we have to practically apply. Yeah. Just talking is not going to change anything.
On the same lines, because we have a lot of doctors here, can you give us like some practical tips, like, one breathing technique that you can possibly teach us, to help with stress management? Because, a lot of doctors eat because of stress eating. We have a very busy practice, a lot of patients. So, one simple technique, that we can use in such situations.
So I always tell even my patients that there's one technique called yogic breathing. In a lot of cyclical vomiting and reflux patient, excessive burping patient, anxious patients, I tell them that when you are taking deep breathe in, when you are inhaling, close your eyes, have full awareness on your body. Even you can do it now. Just listen me, don't see me, and whatever I'm saying, just follow it now. So when just close your eyes completely. Take a normal deep breath first. Now take a deep inhalation, and while inhaling, extend your abdomen out. So you have to take your diaphragm down for doing that. So while inhalation, your abdomen should come out. Second step would be, while inhaling, your chest should come out. So expand your chest a little more. And the third step is, while inhaling, your shoulders will come up. So first abdomen, then chest, and then shoulders. All three you have to expand while inhaling, and shoulders will come out. So this is going to increase the oxygenation in the basal zones, in the middle part, and by keeping the shoulders up, it will expand the inhalation and oxygenation in the apex of the lung. Normally we have very shallow breathing. So if you do it, very deep inhalation, first abdomen, then chest expansion, and then shoulder. So everything in one go, and then slowly exhale. This is called deep yogic breathing. It will cover everything. Okay, so it is diaphragmatic movements coming down. So abdominal muscles will come out. Then full expansion of the lungs and deep inhalation and exhalation, which is going to improve the oxygenation, and it will calm down your mind. So this you can practice for just 2-3 minutes after doing exercise. Because after exercising, we need to oxygenate well. So stretching and breathing should be the last part of the physical activity.
Thank you very much. That's very, very helpful.
Thank you so much for patient listening. Thank you, Dr. Gayatri, Mr. Firdaus, entire team of Forts, and thank you all the audiences during this late night time on Saturday evening. You are listening patiently. Thank you so much. Thank you.